Hello and welcome to my channel. My name is Dr. Tera Maple and I am an acute care nurse practitioner. I work primarily in the ICU. So on this channel, I'll be talking to you about life inside of the ICU and outside of the ICU and everything in between. So stay tuned.
Hello, so I'm going to do a reaction video to some providers giving ACLS to a patient. So let's get into it.
We're going to use etomidate and succinylcholine. Even if the patient's flat, we're still going to give the meds.
So that is odd. Etomidate and succinylcholine are medications that we typically give just prior to intubating a patient. Etomidate is a sedative, succinylcholine is a paralytic. So the goal is to obviously make the patient go to sleep and totally relax their body so that it makes the intubation smooth. You don't want them fighting or breathing, or you don't want to elicit the gag reflex when you go to put the tube down into the airway. So the fact that he would still give it, even if the patient is flat, I'm assuming the patient is in asystole, which means the patient is not alive. That is basically the ultimate sleep, or most sedated a patient can be, the most relaxed a patient can be. So why are you still giving these medications if the patient is in that state? I don't understand, but let's continue.
So guys, essentially what we're dealing with is a cardiac arrest, presumably secondary to PE. Let's get large bore IVs, get them hooked up to the monitors, we'll get blood work going. We'll get Titus to do an ultrasound to look at the ventricles and see what they're doing.
So other than that, everything's looking good. The compressions seem to be deep, good at a good rate. Getting the IVs in the patient so that you can administer medications and so that you can draw blood. Also, now that I think about it, how are they giving the etomidate and succinylcholine if they didn't have IVs? They looks like they came in on the ambulance. They could have already had some IVs placed in the patients, and a lot of times when they come into the emergency department, we place new IVs. So that could be the case, A, or they could have put in, they could have gotten access via the bone, which we call IO, intra-osseous access. But like I said, getting the IVs, the chest compressions, those look good. Getting the ultrasound to look directly and see what could be the cause of what's causing the cardiac arrest. He thinks it's a PE, which is a pulmonary embolus, but they're not really sure. So they're gonna put an ultrasound to see what they find.
Sophie, I'd like you to get epinephrine and give that 1 milligram IV push as soon as you can, okay?
So yes, epinephrine is the medication of choice when you're providing ACLS via the guidelines.
What happens is if you get a big blood clot to the lungs, the heart can't pump blood forward and it pretty much stops the heart in its tracks. Yeah, very good pulse with CPR.
Someone hold the bag up, please. Yeah, his IV is interstitial.
So, couple things. So they're saying, can someone hold the bag up, please? I'm assuming they don't have it. Looks like it's probably just IV fluids, and they want that to go into the patient really quickly. And if you put it on a pump, and a lot of times we put in 999 as far as the rate of administration of the fluids, but that's not as fast as gravity. So holding the bag up, squeezing it, allows it to go in a lot faster. So they're asking somebody to do that. And then I forgot. They let me go back. I forgot what was my second point.
Someone hold the bag up, please. Yeah, his IV is interstitial. interstitial.
Okay, yes, the IV is interstitial, so that basically means the IV is not where it's supposed to be. It is not inside of the vessel; it is in the tissue, and they notice that. So the medication or whatever they're giving is not actually getting into the patient efficiently via the blood vessel. So they're gonna have to take the IV out and put in another one.
Can I get a syringe, please? 10 cc syringe.
So right there, that's obtaining the intraosseous access, putting a needle into the bone so that you can access the vessels via the bone. Because as you heard, they had the IV in the extremity, the regular way. It blew, or it was in the interstitial. So the next best thing is to do an IO. I agree.
A flush or anything. We've got access over here. So we got IO access. 5 seconds to switch. 19.2, thank you.
Okay, so on the next switch, we're going to do an ultrasound, okay, guys?
Alright, let's do 2 minutes.
Okay, stop, guys.
So still no pulse. No pulse.
Pull up there, guys. I can't see.
Looks like
1 second.
Okay, so my problem with that is the amount of time there was no compressions happening, because they were too busy trying to get this ultrasound. Ultimately, you need to be doing compressions, and also they never intubated the patient. When are we gonna get the intubation done? They said, continue the next video. I don't think I ever seen the next video, but so far what I've seen. So I guess we can only judge what we see, but overall, that's realistically how it looks. It doesn't look how it's depicted in movies, but this is the fast-paced, real life, how it looks when you're providing CPR and resuscitation in the hospital setting. Until next time.